All right, Dr. Wilson, we are at the end of the day here at the Exceptional Dental Live Surgical course. If you wouldn't mind, give us your overview and what you experienced here with the students as you're a periodontist and one of the instructors.
Well, my experience, it was pretty pleasant. All the cases are well planned out as far as, I have a few different instructors look at the cases and explain possible complication to the students. Everybody's pretty eager to learn. It's a friendly learning environment. Overall, some of the cases are a little more complicated than they're going to be seeing in their own practices at first, but it's nice because it is a real life type situation. It's not,
Right.
everything's an ideal, perfect case. So they know that some of the cases they do with us are a little more advanced than they'll be doing in their own practices, but I think that that's good for them to see as well.
Right.
So they don't,
Well, we stress that to them as well. Right?
yes, it's very stressed to them.
Right.
These are a lot of the cases we're going to do here, you would not begin doing in your own practice. However, they also do cases here that they would be doing in their practice, and that's pretty much the feedback that we get as well.
What about your perspective about how much we try to integrate CBCT into the overall treatment planning aspect?
It's very emphasized. There's CBCT before and after, so they can evaluate how the implant was originally planned in the CBCT and then how it looks later, and so they can really evaluate how accurate we were in placing the implant. Also, naturally, it gives a wealth of information. So it is basically the standard of care nowadays to have a CBCT, so you can, foresee any potential future complications.
Awesome. So any ending summarization as far as that you want to give from your perspective as a specialist?
I think it's a very good course for people who aren't very experienced because you do have one instructor with you in the room all the time to be able to watch every single step and make sure that the patient is getting, the highest level of care available, and the students are comfortable and encouraged, performing, procedures for the first time.
Right.
That they perform them.
Right. So that way they're not kind of left out to dry, and we're going through everything step by step by step.
Oh yes, no, and there's no waiting. I wonder when the instructor is going to come back so I can proceed. So that's always nice because I remember how that was occasionally, even though I was pretty happy with my program overall doing that. But it's nice having someone there the whole time.
Awesome. Thanks, Doc. We really appreciate it, man.
You're welcome.
Awesome.